Hello everyone, my name is Fiona. I'm one of the specialist oncology dietitians working in South Tyneside and Sunderland NHS Foundation Trust. We're very grateful to have this platform for us to share some nutritional aspect with you, which is related to cancer, and then also providing some resources and recommendation for yourself and your loved ones. During this video, we are trying to also go over some self-management strategy for you to be able to manage your nutrition a little bit better. After your cancer diagnosis, you're often being bombarded with too much information, and nutrition probably the last things that you wanted to worry about. However, it is important to remember a good nutrition often leads to a better treatment outcomes. So your needs could change over time. So initially, we may be aiming for optimizing your nutrition from before, during, or immediately after the treatment, to shifting to a healthy eating lifestyle as prevention for future cancer. There's no one-size-fits-all approaches. Some people may have a little bit more complex needs, depends on the types of cancer and their side effects they experience. However, we can always achieve your nutritional goal by working together as a team. Generally, people with cancer do experience some form of nutritional problems while they having their treatment. It could be either from the side effect from your treatment or if from the cancer itself. Some people feel well and eat normally, whereas others cannot. And it's often associated with weight loss and lack of appetite, or because of nausea and vomiting. And sometimes worrying and stress about your condition can also have an impact for how much you can managing at the mealtime. Not getting enough nutrients into your body could lead to some weight loss, some fat loss, and some muscle loss, which increase your risk of developing malnutrition. About 1 in 4 cancer patients do develop malnutrition, and then it often increases your chance to go into the hospital because of infection, decrease your muscle strength, and then ultimately have a negative impact of how well you're doing on your treatment. When you're preparing for your treatment, it is recommended to aim for weight maintenance and the prevention of muscle loss. So some people may be recommended to have just a healthy diet, but others may need a little bit of additional support. It could be some nourishing diet, or nutritional support, or artificial nutrition support. You may also hear the word prehabilitation, and then the idea of it is to optimize your health, your nutrition, and then your fitness before you're having your treatment. Your treatment could be ranging from surgery, stem cell transplant, to chemotherapy and radiotherapy. And then some people during this time may not need any additional support, but often they need a little bit more nourishing diet, or for some may need a little bit more oral nutrition support, and others some artificial nutrition support. Once you started your treatment, you may find there is a difference of how much you can manage to eat and drink compared to before, or some of the things that you wouldn't think of developed, for example, swallowing difficulties, which may affect the amount and what kind of food that you can manage. And then in this case, we can offer some further guidance on how to add in some high protein, high calories into a texture modified way. Once you started your treatment, you may experience some difficulties in managing to eat and drink. And our nutrition focus should be focusing on having a nourishing diet to prevent any weight loss, and then trying to prevent some muscle loss as well. Adequate nutrition are very important to help you to stay strong when you are doing your treatment, and combat fatigue. We recommended quick and easy meals so that it doesn't take too much of your time when you're already having a busy schedule back and forth to the hospital for your appointments. And then sometimes it may be worthwhile to ask for help. There's a lot of people around you that may wanted to help you, but then they're not sure how to approach you. So it will be nice to discuss this matter with your loved ones and see if there is anything they can help you with. So what is a nourishing diet? A nourishing diet is also called high calories, high protein diet. The idea of it is adding a little bit extra calories and protein into what are you managing. We will recommend maybe trying a smaller portion, but then have it a little bit more often throughout the day instead of a big meal at a time, because sometimes a big meal when you're tired could really put you off. When you're struggling to get enough calories and protein into your daily life, we may suggest something called oral nutritional supplements, which adding on top of what you're managing at the moment. They often come in quite a small bottles, which quite compact with calories and protein. And then it was working as adding on top of what you're managing instead of a replacement. However, when it is harder to achieve your nutritional requirements through oral alone, then we may consider to use something called artificial nutrition. It is generally means putting a tube into your body to give you a little bit more support. However, this decision usually have to made together along everyone who involved in your care, as well as yourself and the people who care for you at home. Lastly, it is important to remember everyone's nutritional needs are different. If you have any concerns regarding to your nutrition, it's best to speak to your specialist nurses or your dietitian for additional support.